Welcome back. It's the Closers here alongside Jay Sparks. I'm George Young. Happy to have you alongside for the ride. We had a guest change. Dr. Sherman is currently in surgery. He's performing it, not part of it. So he has stepped aside. Kyle Blecha, athletic trainer for Missouri Orthopedic Institute, sports medicine coordinator, joining us now here on the program. Happy to have you alongside. How you doing? You're the sports medicine coordinator. You're from Missouri Orthopedic Institute. We'll talk about their clinic as we go along. Again, a reminder, it is Saturday morning, 9 a.m. to 10 a.m. over at the Missouri Orthopedic Institute. It is a fully staffed clinic, x-rays and such. You can get initial assessments. You can also get referrals. But for you, in your role in high school football and all that, what exactly comes under the purview of Kyle Blecha?
Help to put together and coordinate the schedule for residents that cover high school football. Okay,
and by the residents, the University of Missouri has an athletic training program. So are those the residents that you're discussing?
No, actually medical doctors, residents that are they're in their training, whether it's family medicine, orthopedics, or PM&R.
Okay.
Now, as you guys have done the clinic and done what you've done for high school athletes, what kind of feedback after the fact do you get from either their primary care physicians, school officials? What kind of feedback have you guys gotten as you've offered this service?
They're very appreciative. They appreciate that, the access to seeing a physician the day after, or even, sometimes they'll come in the following week. And it's always very positive. And, we strive and providing that access and just be able to, give the have that opportunity for the athletes to get seen, as well as the parents don't have to worry about seeing somebody else. They can directly see a sports medicine provider.
Okay, well, and we've discussed this with the physicians before about coverage, and a lot of them do it because they love the sport, and B, they feel like the time being volunteered is really, really important. And for you as the sports medicine coordinator over at MOI and an athletic trainer, how does the process of assigning an athletic trainer to a Friday night game work for you? And is it the same thing? Is it kind of a volunteer or kind of a relationship type deal with the school?
The athletic trainer already has a relationship with the school, so they're already set. It's a matter of getting the resident assigned with the athletic trainer and what their availability is, because their schedule it can be rather tight depending on what the rotation is and what their assignment is, as well as a clinic can run late. Very similar, what's going on with Dr. Sherman, who's run late today. And so and what their availability is.
Okay. All right. Again, the Missouri Orthopedic Institute clinic is on Saturday mornings. It's from 9 to 10 a.m., and it is primarily directed toward those who participated in the Friday night activities, the junior high school athletes. So get on. If you need to, get over there and get the assessment taken care of. But let's take this to a Friday night football game. The role of an athletic trainer. What exactly is their role on a Friday night football game?
It's preparation. It's communicating with the coach, athletic director. If there's any ongoing or previous injuries that need to be seen or evaluated, be able to take a look at those. Any sort of pre-game wrapping, taping, as well as communicating with the EMS that's on site, let them know they're there, communicating if there's any hand signals or how they communicate if there's a need that their care is, their resource is going to be needed for that day, as well as communicating with the physician that's on the sideline with them.
Kyle Blecha here with us, athletic trainer, Missouri Orthopedic Institute. He's a sports medicine coordinator over there, And on a Friday night, I mean, we've talked about it before, and we'll wrap this up later on with concussion protocols. But of the things that we see calling a football game on a Friday night, because Jay and I do Jefferson City Jays football on Friday nights on KLIK. You see the water breaks, you see the trainer run out there, and they make the assessment on concussions, and you get what everybody has become all too familiar with, especially in the NFL, the drawer test for an ACL. Bringing out the air cast. I mean, how much training is involved for an athletic trainer to be able to handle all of those different scenarios that hit them on a Friday night?
There's extensive training through their education as undergraduate athletic training program, as well as through their training. A lot of us have gone through a graduate assistant program process where we get additional training as we're going to school.
Okay. Communication with the parents, always it can be an interesting and it can be a difficult assessment step for an athletic trainer. So how do you work with the trainer on making sure that it's either the severity or the protocol, the treatment protocol, is then followed by the parent?
It's develop a relationship with the school, the athletic director, as well as with coaches. Those relationships are critical when it comes to communicating not only bad news, but also good news, and explain what the process is, as well as communicating with the attending physician that they're seeing, so that there's an understanding of if there's any limitations or if there's any recommendations, and those can be followed and be communicated back and forth of what that progress is.
Now that the status quo for high school sports is, like you said, at the bare minimum EMS or EMT on the sidelines, or also and getting up more to that as the schools get a little bigger or have a little more resources at their disposal. Has it become, and you've gone cyclically now, you've gone through a few years of this now being the standard. Is there now best practices outside of the games? I mean, is it at practice, at summer camps? Do coaching staffs and schools seek input from trainers for those instances as well?
I think, over time, we've seen those standard of care processes, whether it's position statements or recommendations, being implemented all the way down from the professional level down to the high school and middle schools. And those standard of care don't necessarily change. It's a matter of what the resources are they have available to them. And it's just continue to emphasize the importance of what those policies are, importance of following those recommendations, and now you're seeing where schools are having to implement some sort of policy and procedures, how they manage not only concussions. Comes to heat, how do you deal with the cold, but also how do you deal with some of these traumatic injuries as well as non traumatic injuries?
In your time, and you mentioned off air that you've been here at Missouri for 4 years, and prior to that you were at Kalamazoo, Michigan. Over your time, what's been the biggest technology or resource improvement for a trainer on the sideline? Well,
I think technology is just continuing that education, continuing staying up to what's new out in the field, talking to colleagues of how they're managing or how they're dealing with particular situations, injuries, anything that comes up, and it's also having that working relationship with those physicians. Right. What are they seeing? What are they doing? What are those colleagues doing? Because everybody's maybe doing something a little bit differently, but it all may be the same.
What's helped you though as a trainer, as an athletic trainer, do your job better?
It's always having great physician care. Yeah. For me, that always helps my day because I know I can bounce things off that team physician or the physician, doing a particular situation. Because sometimes what I'm seeing may be different than what they're seeing, and I just be able to have that constant feedback back and forth.
You have an area of expertise, and trainers and EMS, EMT, and everybody else have them. Doctors when they're on the sidelines. You have your best games when you're not needed, obviously, and kind of like an offensive lineman when your name's not being called, you're probably doing things the right way. How does that affect over time? I mean, you provide a service, but it's best when the service isn't used.
It is, and the most important thing is to always talk with those groups. It's always important, particularly prior to the start of the game, is have a timeout. Have that timeout with all the parties, bring them together, from visiting team, EMS, physicians, and let's talk about those processes. How are you going to manage a traumatic injury? Somebody that goes down that needs to be boarded, somebody that needs to be carted off. This is how we're going to manage them, or as well as this is where they're going to be transported if necessary, and what the different levels of care are. And having that timeout has helps to keep everybody tuned in to know what the rules are.
Kyle Blecha, certified athletic trainer, with us here on the Closers. Again, Missouri Orthopedic Institute. The free clinic is on Saturday mornings from 9 a.m. to 10 a.m. over at MOI. It's a fully staffed clinic. X-rays and such can be taken care of. Also, referrals can be made, as well as assessments. And we talked about it a little bit earlier. You kind of referenced it as well about hydration, concussions, and all that. So let's deal with the hydration, because our weather has gone from hot to cold to back to going to be warm again tomorrow night. For the hydration aspect, if you're a parent and you got Johnny and he's ready to get played either JV football tonight or a regular or varsity football tomorrow, or even on the collegiate level on a Saturday, that hydration process should begin when?
It should begin at least 48, 72 hours prior, from drinking water, drinking drinking a sports drink, staying away from the carbonated, staying away from the caffeine. But also the important part of the hydration piece is making sure you're getting some food into you, because that food needs to be able to hang on to something. And if you're not eating, this is going to flow right through you. So the nutritional piece, the dietary intake is critical to the whole hydration, heat illness type.
Sprains and strains, let's say they were assessed the weekend before. How important is it then for the athlete to make sure that the treatment protocol is carried forward, so that the following week they can get back out there if they're able to and not have the adverse problems?
I think it's being honest with how they're doing, what's going on, and they're following through, whatever those exercises are or whatever that treatment plan is, and also being honest whether it's able to go or not, and if you're effective, because if you're not able to go, you're kind of hobbling around, limping around, you're going to hurt yourself even further or hurt something else. And
finally, and I told you before we got started, we'll wrap up with everybody on this, because it is an incredibly important aspect of sports, and it doesn't matter whether it's football, it's basketball, whether soccer, cheerleading even has this issue. Concussions. The markers of a concussion, and that the parents need to be aware of, especially that next day. What's that checklist process for a parent for an athlete?
Are they acting like themselves? The parents are able to see something. Are they, disoriented, headache, dizziness, sensitive to light, sensitive to noise, just not feeling themselves, kind of feeling like in a fog. And parents are probably more tuned in to what how the kids act than most, and seeing that if they're kind of seeing a little off, it is critical to get them evaluated. Particularly by somebody who's trained, can manage with sports-related concussions. So that's critical. Somebody such as, an Aaron Gray or Tiffany Bohan or Luke Stevens, somebody like that.
Yeah, that's and again, that free clinic is Saturday mornings from 9 to 10 a.m. and that's a great time if your athlete gets up in the morning or doesn't get up in the morning at the regular time, or complaining about the headaches or light, as you mentioned, Kyle, the light sensitivity, that type of thing. Get them over there, get them assessed, because that is. The head injury is not something to fool with. I had a kid who had 2 concussions in lacrosse, and that ended his lacrosse career. And actually, they came almost 4 months apart.
Yeah.
So it is not something to mess with, folks, and that's why you may be like, oh great, they're talking concussions again. You can't talk about it enough. You really can't.
No, you can't. It's on everybody's mind. It's in the news. It's constantly there. Whether it's an NFL player going into the concussion protocol, or some of these other unfortunate incidents that occur that it's in the media, and and then I think the most important thing is awareness and education for concussions is something that it can never be overstated.
And just real quickly here, as we get ready to wrap this up, Kyle Blecha with us, a certified athletic trainer. When the trainer comes up to the parent or comes up to the coach and says they're done, how much weight does that carry?
I think it carries a lot of weight. We're fortunate to have some position statements out there right now that, you're the most qualified person to handle these situations, these conditions, and because of that, taking them away, getting them evaluated, it's critical because there's too many instances where something just wasn't caught soon enough, and unfortunately you see some unfortunate outcomes.
Yep, and we'll wrap this up not on the unfortunate outcome, but on what the most rewarding part of your job. What's as you've gone through it over the years, what's been the most rewarding part?
Oh, I think over time it's always getting build relationships with everybody you work with, whether it's it's an athlete, it's the coach, it's the physician, it's the relationships. They go with you a long time. I get texts from friends all the time. Some are working Saturday and Sunday nights, and to kind of hear how they're doing. It's pretty cool.
Kyle Blecha, certified athletic trainer, Missouri Orthopedic Institute, sports medicine coordinator. Kyle, thank you for the time. I really do appreciate it, and thank you much as well for the information.
I appreciate you having me, and it's great to be here.
You are very welcome. Again, the clinic, Missouri Orthopedic Clinic, on Saturday mornings from 9 a.m. to 10 a.m. It is over at MOI. It is a free assessment clinic. It's fully staffed with x-ray machines and such, and they can also provide referrals if you do need that.
The Closers on News Talk 1240 KLIK and News Talk 1400 KFRU.